An inflammation in the bronchial tubes that leads to swelling is known as bronchitis. Bronchial tubes are responsible for passing air to and from the lungs. When pathogens, including viruses and bacteria or dust, enter the air passage, they cause inflammation and swallowing. This inflammation could irritate the lining of bronchitis and then cause coughing, which could last from 10 days to several months. Based on lastness, this infectious disease has two types: acute bronchitis and chronic bronchitis. It affects people of any age, gender, and sex. Bronchitis is not contagious, but as most viruses cause it, it could spread by respiratory droplets by coughing and sneezing from one person to another. To avoid spreading it, use a tissue while coughing and wash your hands properly. It could be treated by medication, but if someone wants to prevent it, he can adopt some natural methods. Let's move deep into the video to learn about its types, symptoms, and treatment of this disease. What is meant by bronchitis? A condition in which the air passage leads to the lungs becoming inflamed. The air pathways consist of the trachea, a tube from the nasal to the lungs, and bronchi, which are small air sacs in the lungs. These are responsible for carrying air in and out of the lungs. Due to the entry of the virus or other pathogens through the air, these structures become irritated. They fill up with mucus and swell up, ultimately leading to coughing, the main cause of bronchitis. How many types of bronchitis? Bronchitis is divided into two main types based on its lastness: acute and chronic bronchitis. Acute bronchitis generally. Bronchitis is known as acute bronchitis. It's a viral infection of bronchial tubes that lasts for a few weeks and goes away. It's also called a chest cold, as its symptoms are closely related to a cold. A study also reveals that the same virus may cause this inflammation as the flu or cold. If a person has a cough, with or without mucus, fever, body aching, breathing issues, and chest discomfort, it means he is affected by acute bronchitis. People usually recover from acute bronchitis without any treatment. Chronic bronchitis, the most severe condition of bronchial inflammation, lasts up to 3 months in a year, and the worst thing is that its symptoms never go away. In rare cases, it goes away but comes back again. During this condition, irritation in the lining of the bronchitis continues. If someone has chronic bronchitis, he might have chronic obstructive pulmonary disease. If a person has emphysema with bronchitis, it means he must be diagnosed with chronic obstructive pulmonary disease. As its name is chronic, it means it is a life-threatening condition. What are the leading causes of bronchitis? The leading causes of bronchitis are viruses like cold flu and influenza, as well as adenovirus and rhinovirus. Bacteria that can cause bronchitis include mycoplasma, pneumonia, and Bordetella pertussis. However, any exposure that irritates the air passage or lungs can cause this disease, such as tobacco, dust, infectious respiratory fumes, toxic gases, and other air pollution. Cigarette smoke is the foremost cause of this infectious disease. These germs enter the air passage bronchial tubes, which swell and lead to harder breath. Describe the risk factors leading to bronchitis. Here are some factors that lead to a person having a higher chance of bronchitis. These include the smoke of cigarettes. Primary smoking or secondary smoking is a great factor in getting bronchitis for both acute bronchitis and chronic bronchitis. Remember, female smokers have more risk than male smokers. Heartburns, severe gastric reflux may irritate your throat continuously, leading to bronchitis. Environmental factors. If exposed to lung irritants such as grains, chemical fumes, or others, there is a higher risk of bronchitis. Weak immunity. If you have a weak immune system, have any other acute diseases such as a cold, or have low resistance against germs, you are at greater risk of getting this disease. Gender. If anyone has a family history of lung disease, he is at greater risk. What are the symptoms a bronchitis-affected person experiences? The main symptom of bronchitis is a persistent cough that lasts for 3 weeks. The mucus of white and yellow with cough is the ultimate symptom of bronchitis. A sound while breathing, known as wheezing, is another symptom of bronchitis. Other symptoms include dyspnea, low fever, fatigue, shortening of breath, soring throat, and runny nose. Remember that all bronchitis symptoms may heal, but the cough will remain for weeks. But if the cough lasts longer, there may be any other disease besides bronchitis. How to diagnose bronchitis? The doctor or your healthcare provider will take a quiz about your disease history and symptoms, and then he will examine your lungs by placing a stethoscope to listen to the sound of your lungs. The doctor will ask about medical history, recent bouts of flu, smoking, exposure to smoke, dust, and other symptoms. The doctor may take oxygen tests in the blood, chest X-ray, pulmonary lungs test, and bacteria or virus test. How to treat bronchitis? There are two ways to treat bronchitis. One is natural, and the other is medication. Natural treatment. If you want to recover from bronchitis, naturally follow these suggestions. Drink fluid. Take rest. Use a humidifier to improve airflow. Use honey in tea or hot water. Remove lung irritant like dust or smoke. Medical treatment. Take cough medicines. Coughing will help remove mucus from the bronchial tubes. Use a bronchodilator. This will open the bronchial tubes. To lose mucus to cough up sputum, use mucolytics. Use steroids to reduce inflammation. Use antibiotics if a bacteria is the cause of bronchitis. How can a person prevent bronchitis? If you want to prevent bronchitis by yourself, then follow these things. Avoid smoking cigarettes. If you are a smoker or live around smokers, avoid inhaling cigarette smoking. Vaccination. The main type of bronchitis is acute bronchitis, which usually results from the influenza virus. Get a vaccine for the flu yearly to protect yourself from bronchitis. Keep washing hands. Bronchitis is usually caused by a virus, so to avoid catching a viral infection, keep washing your hands with a hand sanitizer. Wearing a mask. If you are exposed to dust or fumes, always wear a clinical mask to avoid environmental pollution. Is bronchitis similar to COVID-19? Bronchitis is caused by any virus, including SARS-CoV-2, which causes COVID-19. The symptoms of bronchitis are similar to COVID. So, if you have bronchitis symptoms, you should immediately consult a doctor and undergo a diagnosis to identify the causative agent of the condition. The doctor can easily understand your condition and treat you appropriately based on your test results. If you enjoyed this video, don't forget to like, share, and subscribe to our channel for more captivating content. And as always, stay curious and keep exploring.